So before performing urine catheterization, make sure you have assessed the patient for the GU assessment. Check the distension of the bladder by palpating the lower abdomen or by using the bladder scanner. Verify the physician's order for the need of catheterization. You can now proceed with your patient, identify yourself, explain the procedure to the patient. Make sure you have checked the ID band of the patient with two identifiers, the patient's name and the date of birth. And once you've done that, you can ask the patient to raise her knees up and open her legs wide. Perform your hand hygiene and apply clean gloves. Inspect the area for any odor, for erythema, and also the anatomy, so you can locate the urethra easily when you're inserting the catheter. So after that, you can remove your gloves, apply hand hygiene again, gather all your supplies. So assuming this is the patient's bedside table, you can get your Foley catheter kit. Make sure you have the appropriate size for the Foley catheter, your sterile gloves, and your urine bag. Okay, so you can open the your catheter kit, your Foley catheter kit. There's I think okay. So you can get you have to put an underpad on the patient, so I'm sure there's one here, so you can just get it. Make sure you haven't contaminated the rest of the inside of the kit. Then you can place this nicely on the patient's under the patient, so you can just put it like that. And then wear your clean gloves, do hand hygiene again, and wear your clean gloves. Clean the perineum with warm water and the soap, or using the perineal cleanser. And then after that, you can remove your gloves and do hand hygiene again. Prepare your sterile tray, and make sure you have checked also the expiration dates of the kit and the Foley catheter. So you can open this inside your discard this. There's a clean wear your sterile gloves. Do hand hygiene again, wear your sterile gloves. Make sure, just assuming this is also a part of the side table, you haven't touched the inside of the gloves. And yeah. So open up the catheter and check for the balloon. Just to make sure that the balloon is intact. And then take out everything again. Make sure it's neatly. You can leave the syringe here, and if there's no need to collect the urine, you can attach the bag. Make sure the bag is also sterile, and then you can just leave it here. Okay, so once everything is here, you can prepare you can bring this to the patient's leg. So now you can drape the patient using the sterile drape, the fenestrative drape inside the kit. Just make sure not to touch anything beyond, and that you have provided privacy for the patient. You have put blanket and just exposed then the perineum. Okay, and you can now prepare the catheter, lubricate the tip using the jelly. So just put it aside. So this is still sterile, so I can just put it one side here. And then you can now clean the labia using the cleaning solution. Open up using your non-dominant hand, open up the labia and then wipe from top to bottom using one cotton bud each, using one cotton each time you wipe. So make sure. Okay. So you can now insert your catheter. You can put this here. If you need to collect urine, you can just put the end on a container using your right hand, and while opening up the perineum, you can insert it on the meatus, the hole, and then insert approximately 5 to 7 centimeters. Once there's a backflow of the urine, you can advance more, another 5 centimeters. So for example, it's already there. You can now inflate the balloon. Okay, once you've inflated the balloon, and then you can just take it out and then put the bag lower than the patient, and just gently tag the catheter until there's a resistance, and then the balloon is inside the patient. So once you have done that, you can secure the bag onto the patient's leg, and then you can now dispose everything. Just tear this drape so you can remove it, and then take off your gloves, do hand hygiene again, reassure the patient, check the patient if she's comfortable before you leave, and then do the documentation, record everything including the size of the catheter and the time that you inserted it. Also, if there's the urine, how much urine have been drained.